Hello everybody, welcome to this week's episode of The County Seat. I'm your host, Chad Booth. We are bringing you our show from the commission chambers of the Carbon County Courthouse Complex in Price, Utah. We are here today to explore a topic that nobody wants to talk about and a lot of people in rural Utah do not recognize. And that is that there's an alarming rate of heroin addiction that stems from opioid abuse that is spreading across rural America. Not just here, but at the entire country. That's the focus of our program today. Let's get a look at the microcosm of addiction in rural America.
You're talking about a town of 1,000 people in the middle of rural nowhere, and we have 8 EMT calls in 1 month for heroin overdose.
Since I came on board as a felony prosecutor in 2006, we've had constant growth in our caseload, to the point now we're nearly double what our caseload was when I began prosecuting.
In the last year, we had over 190 overdoses in our hospital. And between the ages of 14 and 36, there were 80.
There is no group of people that's exempt. Every socioeconomic class, it doesn't matter what church you go to, what school you go to, how much money your parents make, how much money you make, what job you have, it affects everyone.
I had met with a sheriff from a small county in North Dakota that has 2,500 people in it. Same problems. They're struggling with heroin addiction. They're struggling with lack of resources to address this stuff.
You know, businessmen, young kids in high school. You hear that any high school, you can get heroin at any high school.
You see athletes that get hurt and they start with opiates and they move into illegal drugs to overcome it. Housewives that's been in a car accident.
Last year, we saw over 20 babies being born to addiction in some form or another from a substance.
The face of this addiction is not the typical face. It's absolutely anyone that you can pick out of a room could be addicted to opiates at any time.
You know, you get Johnny Football who comes in on the weekend from an accident, and he's only got a couple pills that gets him to his doctor's appointment. We try to do our best to where they can make sure they get their doctor's appointment, but it might not be enough. And where he may have used heroin once in the past, he turns to heroin.
It's just a quick fix. But once you get on this stuff, you can't get off of it.
Our problem here in Carbon County is enormous. It is a big problem. Every family in Carbon County is affected with this issue, I can guarantee it.
You will start to see people that are getting involved in the drug community. You'll start to see them on the fringes of the reports. They'll be involved, but they're not the main suspect. And then it's sad to say, but you can see it coming. I'm
going to go out on a limb and say that 80% of the criminal conduct in Carbon County is related to drugs. The drug issue in rural Utah is our biggest problem that we deal with day to day. And at the rate that it is growing, we're getting to where we can't handle that. You know, it's too much for our small law enforcement team.
The resources that we have here are limited as well when it comes to inpatient facilities. With funding. The sad thing about it is if you don't have insurance, there's only so much funding that we do have in order to be able to help the people.
With the limited resources in rural Utah, we have one option, and that's our local Four Corners Mental Health, and all they can do is all they can do. They're handling every piece of the pie, not just the legal piece. Drug
courts have shown that prosecution, law enforcement can work hand in hand with treatment, and we can build good programs that supervise people and give them the structure and support they need to be successful. Most of the people that we see with addictions are not criminals.
So now that we have a look at the problem, the solution is equally complex and difficult to achieve. But we will tackle it when we come back on the County Seat.
The Utah Farm Bureau has always been there to fight for the needs of its members, with discount programs on items ranging from vehicles and ATVs to health and wellness. The membership fees aren't big, but the results are. We've been around since 1916, and we're not leaving anytime soon. Utah Farm Bureau. We work for those who work to feed the world.
There's a little place on a Utah map, where I was raised, where my heart's at, where the sagebrush grows wild and high, and the stars come out at night. Oh, there ain't nothing like being raised in the basin with a Ute reservation, skiing starvation, that Duchesne County life.
ATV? Check. Four-wheel driving? Check. Bouldering? Check. Mountain biking? Check. Hiking? Check. River rafting? Check. Adventure is about more than just crossing activities off of a list, but hey, if you can find a place that gives you everything you're looking for, all the better. In Emery County, you'll find the San Rafael swell, trails, lakes, and the small-town hospitality you're looking for. San Rafael Country, in the heart of Utah. Visit us and check something off your list.
The weekends just never feel like they're long enough. By the time you get to a destination, you're worn out and you may need a vacation to recover from your last vacation. The solution is closer than you think, and that's just what you need. You can find the desert at Little Sahara, the cool refreshment of Yuba Lake, escape to the green of the forest on the Nebo Loop. Make your escape to Juab County. It'll change your family forever.
Welcome back to the county seat. We are talking today about the opioid problem and heroin addiction in rural Utah. Joining us for our panel discussion is Karen Dolan, who's the executive director of the Four Corners Behavioral Health Group. Thank you, Karen, for joining us. We have Jake Mellor, who's a Carbon County Commissioner down here in Price, Utah, and we have David Cunningham, who is the health officer for the Southeastern Utah Health Department. Thank you all for joining us. So we kind of have an idea now of the scope of the problem, and we see that it's big. I think it's important to acknowledge that Carbon County is not just in the pool, it's at the head of the pool. Maybe you can address that for us, David.
I guess just a little background of where I'm coming from. 23 years ago, I worked in substance abuse. I was the program director in some chemical dependency unit. And there was the people that came into treatment, the hospital I worked for, one of them, it liked to cater to the more famous people in Salt Lake and people with a little bit of notoriety. And the doors or the beds were never empty. There was plenty of people coming. But it's been a problem forever, addiction has. But right now we're dealing with a problem in our area, and it's even regionally, there's other health and human service programs that Region 8 is what we belong in. And that's most of the western states, the kind of the center of the western states. But Utah has a big problem. And here in this area, even in small Carbon and Emery counties, we've got a problem. I mentioned to the people at HRSA yesterday that our area, there's not a person that I could talk to that I know that are on the streets that this hasn't hit them directly, that they know someone or their neighbors or their relatives that addictions hit them and hit them hard. It is something we do need to discuss, we do need to find solutions for.
Karen, do you feel overwhelmed with the enormity of the task and the amount of resources you have?
We do. We have so many opioid addicts. And 4 out of 5 people that begin or end up being a heroin addict starts out by taking pain pills. So we have many extraction industry workers around here that have worn out their bodies and they get addicted to pain pills, and when that runs out, they turn to heroin. We also have people that can travel to Salt Lake, buy heroin for $10, come back and sell it for $20, so it supports their habit. We have many, many people, and with opioids, it takes over their brain, so they're not functioning well and they're not thinking clearly. And bridging them from their addiction to treatment is really difficult. We have gaps in services in terms of detox, in terms of getting them on medication that can help them reduce cravings, to keep them in treatment long enough to get their brains functioning again.
So let me follow up with that. There are some people that say, well, just legalize it all, and you know, the criminal aspect of it will go away, and so what if they function on heroin? But you said it actually takes over their brain. Is that not a viable alternative? Because there's some people who will say that is.
That's dangerous because heroin and opioids are so deadly. We have purchased lots of naloxone kits and we're giving them out. If you can keep somebody alive, you can get them into long-term recovery. Legalizing a drug as dangerous as heroin is a scary prospect because, you know, there's a certain number of people that may try it and may not get addicted, but a whole lot of people do get addicted, and it's deadly. And it's inconsistent in the dosage, so you never know kind of what level you're getting. Also, people will go into treatment for 30 days, get out of treatment, and use at the same level as when they were entering treatment and overdose and die. So that's a dangerous proposition.
Are opioids self-escalating? You have to go further and further until they get the same impact?
Absolutely.
You do. If you just drew a level line, and this is where your normal being is, where you're happy, where your stasis is. When you take a drug, it'll rise above that line. That's the high that you get. And then there's always the rebound. You always have a recovery part, which drops below that normal line. And as you use the drugs and you get more and more into it, it takes more and more to get the high. And that's what you're looking for, is that high. But pretty soon, people who become addicted, they're using the drug just to stay on that level line. And most of the time they're below it, just trying to get back to level. It does destroy their life, and that's one reason that it is so addicting. You just can't get back to that norm.
You know, Chad, I think that there's also a misconception on who this affects. So a lot of times when we think of people who are using drugs, we're thinking of perhaps individuals who are poverty-stricken, who don't have jobs, who are already criminals of nature. But the reality of the fact is a lot of people, it could be high school sports athletes, could be the star captain of the team that has an accident, that gets, you know, addicted to oxycontin or codeine or whatever. You know, he gets addicted to his pain medication and then, you know, has to get off of that or can't afford the medication necessary to help him in his circumstance. And heroin is so easily available. Other drugs on the street are so easily available that your normal everyday citizens, people that have good jobs in the community, students at school, from good church-going families, this actually affects all of us in rural Utah.
Great. This is a good point to take a break. We will pick up with this topic when we come back right here on the county seat. We're talking about heroin addiction in rural Utah. We'll be right back.
When the road takes you farther than you knew possible, when the world is more beautiful than you've ever seen, when home is more comfortable than it should be, this is when you know you're in Kane County. The perfect mix of rural and urban, culture and adventure. Glendale, Orderville, Kanab, Bigwater, small towns with more to offer than just peace and quiet. Kane County, Utah. Find the new you.
149 million years in the making, dinosaurs once roamed this land. Now they're found at the Dinosaur National Monument. Let's take you beyond the bones. We call it Dinosaur Land. You'll find it offers adventures and sights not seen anywhere else in the world. Come to Dinosaur Land, Vernal, Utah. You'll want to stay forever. The dinosaurs did.
What do you picture when you hear Rich County, Utah? Bear Lake Adventure? Snowmobile action? Pristine skiing? Spectacular solitude? Well, if that isn't what first came to mind, then you just don't know Rich County. The Bear Lake Monster Polar Plunge, snowmobiling Monte Cristo, ice fishing Bear Lake, skiing the backcountry, fishing at the Cisco Disco. Come and find out what you never knew you were missing. Rich County, Utah.
In a place that is beyond words, there is nothing to be said, except take your time in Bryce Canyon country.
Welcome back to the county seat. We are talking today about heroin addiction in rural Utah. We've kind of covered some of the basis, a little understanding of how this works and why we have to make it a problem. So we've looked at the statistics, we've looked at the numbers. It's Christmas time, Santa Claus wish list, and he's going to let you fill it out. What's on your wish list? What would help really solve this problem and turn things around?
Well, I would say at this point we have a patchwork quilt of small amounts of money that pay for people who can't afford treatment. The very best treatment outcomes in the country are for those who are pilots and doctors. And that's intensive treatment initially. It's a lot of supervision, it's drug testing, it's a 5-year program. Very, very intensive, and they have the best outcomes. What we have now, maybe 28 days, maybe an outpatient program. Most of the people that come in for treatment don't have funds. We've written pieces of grants from the Department of Health. We have a little bit of Medicaid. We have some federal block grant funding, not enough funds. The best treatment outcome, the best that you can do for treatment for these people are help with detox, help with inpatient, long-term supervision, structure, and treatment to give them enough time, their brain's clear, they're able to get into long-term recovery. And we've seen it. We've seen a lot of people enter long-term recovery, get their lives back together.
So somebody would sit back and look at that, and they would say, my gosh, that could be millions of dollars. That could cost more than what we're spending to incarcerate them. Do you think it would be?
I think it would be a lot cheaper than incarceration. Absolutely. Incarceration is $25,000 to $30,000 a year. Treatment could be $6,000 to $8,000. And people keep their children and get their lives back and become taxpayers instead of tax users. And they don't die. And there's great benefit.
Drug addiction, it destroys the whole family. It's not just the individual. And when you do the incarceration, you might just think, okay, is it cheaper to do that than to get them treatment and to get them squared away? But when you think of the destruction of the whole family and it, essentially the whole community can be affected by it, you need to deal with it as an addiction. You mentioned, your words was make it a problem. And to me, I just would use a different word, awareness. We've got a problem here. A big part of addiction is denial. And I think we have a lot in our community who are flat out in denial. So I think number one, we make sure that there's a greater awareness as to what the problem is and that it is here and we do need to deal with it. And I think there's a lot of education that would go along. When we talk about addiction starting with just painkillers, and then it can go into other things like the heroin. I think there's even an education that needs to be done with our local doctors and their prescription practices and the pharmacies and tracking a little bit better who is getting that type of a drug and painkillers. And then a big piece of it is funding. When we live in a rural community, I run about 30 different grants from the State Health Department, and the funding that comes to the locals is so minuscule compared to the resources that are already along the Wasatch Front, for example. And they have those resources and they're getting the funding. We don't have the resources and we get very little funding because of our numbers here. And so that lack of resources, whether it's in treatment programs, educating the doctors.
Another thing that's really important is prevention. Addiction is the one disease that's completely preventable. If children never use, they'll never get addicted. So good prevention programs. I know Jake's on a coalition to help with prevention. We need to start early. Drug court is late stage disease. If we start early in the schools, really educating kids, doing things that will build up their resistance to using drugs in the first place or alcohol, that's another thing on my wish list.
I guess there's some people, and maybe Jake, you can address this, that think of this and say, okay, if we put all this treatment in place, it's going to just bring more requirement for treatment. And it itself, by being lenient with the problem, will self-escalate so to speak. Do you think that's actually the case?
The community really needs to be behind whatever program is implemented in the area. Recently, we were trying to follow the Communities That Care model. We're actually on step 3 of step 5, getting this all structured and organized. Our coalition that we actually have formed is called the CARE Coalition for Carbon, Addiction Reduction, and Elimination. And the reason that we've formed this, we've brought together 12 different sectors of people here in our area to represent the needs that we have to help combat the drug addiction that we have in our area, the drug, opiates, substance abuse. And we need to focus on that most influential sector, which is our children. Now, yes, like Karen mentioned, when people are in recovery, that's late stage. We need to hit it before with prevention. An ounce of prevention is worth a pound of cure. We really need to have some kind of program to help out with that. And locally, we're forming an organization to assist with that. And we have funded it to a certain extent and level. But as David had mentioned, per capita, we have a bigger problem than a lot of urban areas. But our numbers are still, per person, small enough that we don't get the funding that other places do. We need to be backing this effort as a community, but we also need some assistance to make these programs possible.
Is part of treatment kind of like a, you know, you've got a fixed overhead. It takes so much to, you know, before you can transport the passengers, which costs you so much per mile, you got to buy the van. And everybody's got to buy the van, whether they're hauling 10 passengers or 100. Is that kind of how this works?
We need a clinic. We need a clinic that anybody can go to, and we don't have that.
Well, treatment funding is based on incidence and prevalence, also population. So around the state, we're about 2% of the population of the state of Utah. So we get about 2% of the funding. You know, about 1 in 10 people will become addicted. So those of us in this room may never become addicted. So 1 in 10, but those 1 out of 10 cause lots and lots of social problems and family problems and are expensive to keep in jail and prison and need a lot of help. So I think starting very young and treating all the way to the end stage of the disease and never giving up.
I sit on a board for the state of Utah with the Department of Workforce Services, and we need to provide a good workforce in our area, and we need to be able to help our workforce maintain itself. And this is part of that.
Okay, very good. We're going to take a quick break. We'll come back with the county seat. We're talking about heroin addiction. I'm going to ask our panelists to come up with a plea to our state leaders and federal leaders as to what they think needs to happen when we come back on the county seat.
What would you do with an extra day in Utah Valley? Explore the Wasatch Mountains? Snap a family photo at Bridal Veil Falls. Cool off on Utah Lake or the Provo River. No matter what you're searching for, you can find it in Utah Valley. Bring everyone together.
There is a place where looking out means looking in, where an impression lasting only a few seconds will be imprinted on a life forever, where courage is forged and innocence rediscovered, where remembering is rewarding and forgetting unforgettable. There is a place where truth is felt and where seeing is believing. There is a place.
Unlimited opportunity for adventure. It's all about knowing where to look. ATV adventures, rock crawling events, art festivals, and wildlife events. The opportunities are limitless. Pick your adventure in Millard County.
Beautiful scene, isn't it? The great wide spaces of the wild, wild west. Hi, I'm Chad Booth, host of At Your Leisure. I'm asking you to support the Blue Ribbon Coalition. Their efforts responsibly preserve access to our public lands. If it were not for the Blue Ribbon Coalition and their efforts, you may not have access to millions of acres of land across the West. This is America's playground, and if we don't do anything, we are going to lose it. Join, participate, and donate. Welcome back to the county seat. We are talking about heroin addiction in Utah. We've kind of covered what needs to be done, what the scope of the problem is, but we still, as of right now, you don't have the help you need in rural Utah. So right now, let's just assume that the governor, the legislature, all the federal agencies, all those guys are watching the show right now, and you've got 3 minutes to talk to them. What are you going to ask them?
Well, I would say we have a very serious problem. We have a lot of young people dying, a lot of all-age people dying of overdoses. We need funding for naloxone to keep them alive. We need funding for detox. We need funding for inpatient treatment and long-term support, treatment and supervision combined together to help these people get back to functional lives.
One of the things I see with, we can have a legislator, a local one, who can raise enough money during his legislative session to dredge a lake and to do some things locally that's great things, but we're talking about people's lives, and we're talking about their families and destruction of that. And I think if they would look at when their funding goes for a health issue like this, whether it's to mental health or public health, the formula to disseminate the dollars usually goes population-based. And what they need to do is look at need. And I think our area is a hot spot, and the need is there. And I think if the funding could be brought through our local legislators, even nationally, mean not much less to them, but our local legislators, they can bring the dollars to us. They can funnel that, and they can do it according to need.
Sounds like you need to invite them to come down and see the problem firsthand.
Yes.
You know, we need to fund prevention as well. And like you mentioned, we need to bring them here and help them see what kind of an issue we really have. They say that we're less than 2% of the population in the state of Utah, but we're far more than 2% of the problem. And that's not unique to Utah. A lot of rural places in states throughout the country have that same issue. They receive almost no funding, they have almost no resources, and they have per capita more of a problem than a lot of the urban areas. And so there's a lot of things that we need to be doing here locally in rural Utah to bring awareness to our legislators so that they understand what kind of a problem we have, and they can help us strategize to how we can prevent those problems. Right now with the youth, if they want something, whether it be illegal or not, or however they get it, it's not hard for them to get it. If they want to go out there and they have a need, whether it's an addiction or curiosity, they can get it. And so we need to focus on education, we need to focus on prevention, we need to focus on every stage, but primarily I think where we're going to have greatest success is before it starts.
Thank you so much for joining us for this conversation. Appreciate it a great deal. We'd like to thank all the people who participated in this particular episode, and we'd like to encourage you to have the courage to really face this problem and have a discussion about it with your family, your friends, your legislators, and other people in the community. That's it for the county seat. Remember, local government is where your life happens. Be part of the process. We'll look for you next week on the county seat. If you'd like to share this video with your friends, well, you do that right here. If you would like to subscribe to our YouTube channel, you do that over here. If you'd like to interact with us on the county seat, that happens over here. If you want to watch the next episode of the county seat, you can catch it Saturday night at 11 or Sunday morning at 8:30 on ABC4 Good for Utah.